Hello everyone. Today I will narrate another previous topic, pleural effusion. In AIIMS May 16 and 20, question were asked from pleural effusion. I will explain the question answer while I narrate the topic pleural effusion. I am making this previous topic guided videos so that you can easily revise medicine within 1 day or 2. For example, you can revise the rheumatology within 1 hour. You can check the playlist in my channel. So let's start with pleural effusion. It is excess accumulation of the fluid between pleural layers, leading to restricted lung expansion during inspiration. Normal amount of fluid is 5 to 15 ml. Investigation choice for minimal fluid effusion is CT chest more than USC chest. So minimal 100 ml fluid required to detect on chest X-ray upright lateral view, 200 ml for chest X-ray upright frontal view, 300 ml for clinical detection, and more than 500 ml for obliteration of the hemidiaphragm in chest X-ray. On chest X-ray, the pleural effusion shows obliteration or blunting of the costophrenic angle and meniscus sign. In AIIMS 20, question are asked that what is the next best management in the patient diagnosed on pleural effusion on chest X-ray. There is chest X-ray image which shows pleural effusion, and question are asked which is the next best management of the patient. Answer is USC guided aspiration. Based on light criteria, fluid is exuded if any one of the following three present: pleural fluid protein by serum protein more than 0.5, pleural fluid LDH by serum LDH more than 0.6, or pleural fluid LDH more than 2/3 of the upper limit of the normal serum LDH. If any one of the three present, then it is called exuded fluid. Exuded means cloudy fluid, cellular. It is due to mainly malignancy, inflammation or infection, trauma, and this need to be drained due to risk of infection most of the times. And transudate is clear fluid, hypocellular, due to increased hydrostatic pressure, for example heart failure or sodium retention, and or due to decreased oncotic pressure, which is in nephrotic syndrome or cirrhosis. And there is also lymphatic pleural effusion, which is also known as chylothorax. It is due to thoracic duct injury from trauma, malignancy or filariasis. There is milky appearing fluid, and there is increased triglyceride. However, in 25% of the cases, light criteria may misdiagnose transudate and exudate. Therefore, you also check pleural fluid sugar, cytology, and ADA. Low pleural fluid sugar is seen in infection, malignancy, rheumatoid arthritis associated pleural effusion. This was also a previously asked question. Cytology is mainly due to detect malignant cell. Procedure of choice for management of patient with pleural effusion is pleurodesis. After aspiration of the fluid, pleurodesis is done to stop the recollection of the pleural fluid. ADA to detect tubercular pleural effusion. In AIIMS May 16, question was asked: in a suspected case of TB pleural effusion, which of the following test you should not do? Option was ADA, gene expert, LDH, and albumin. Answer will be albumin. Albumin is not done. ADA is done to detect tubercular pleural effusion. Gene expert done, which is actually the investigational choice for tubercular pleural effusion from pleural biopsy. Gene expert CBNet from pleural biopsy, not pleural fluid. LD is done to detect if it is exudate or transudate, and albumin is not done. It is actually protein which is done. So protein is done to detect exudate or transudate. So albumin is the answer, which is not done in a suspected case of tubercular pleural effusion. Hemorrhagic pleural effusion has hematocrit value 0.5 times than of the blood, seen in TB, CA lung, mesothelium, and trauma. This is a table. You should remember the indication of the ICD tube insertion and just read one time the normal pleural fluid values. Indication of the ICD tube insertion are loculated pleural fluid or emphysema, pH less than 7.20, glucose content is less than 60 mg per dl or less than 3.3 millimole per liter, and presence of gross pus in the pleural space, and positive gram stain or culture of the pleural fluid. These are the indication of the ICD tube insertion in case of pleural effusion. So in next video we will discuss another previous topic. See you in next video.